Well, in tonight's Eyewitness News Health Watch report, oral cancer is on the rise in the U.S. It kills twice as many Americans each year compared to cervical cancer. But as Health Watch reporter Kelly Lynn reports, a new non-invasive test can help stop that cancer dead in its tracks.
Dentists say the test is a great tool because it can take years before precancerous white spots or lesions in the mouth evolve into cancer. And once they do, it's often too late. A trip to the dentist may have helped Ken Schneider prevent oral cancer.
I saw what I thought was an unusual white spot or a lesion, and I decided to have it examined further.
10% of Americans have these lesions, which can turn into oral cancer. While most are not precancerous, the brush test can help you be sure without any cutting.
We just rub the brush.
The dentist scrapes cells off the spot with a brush and sends them to a lab where they're tested for abnormal or precancerous cells. Ken's test came back positive, and he immediately went to an oral surgeon to have the lesion removed, essentially preventing a cancer from occurring.
It's always better to determine and deal with suspicious lesions earlier rather than later.
By the time you diagnose an oral cancer, a lot of times it's so invasive. It gets your tongue, it gets your jawbone, it gets your lymph nodes.
Only half of all patients diagnosed with oral cancer survive more than 5 years. Studies show it's rapidly growing among women, young people, and non-smokers. The American Dental Association has now launched a nationwide ad campaign urging Americans to ask their dentist for the brush test.
So the good news is, if you go to your dentist once or twice a year, you won't get oral cancer.
A simple solution to prevent a life-threatening disease. The makers of the test say so far it has picked up more than 10,000 precancerous spots. I'm Kelly Lynn with Health Watch.
That's some good advice. More than 500,000 new cases of cancer of the mouth are diagnosed each year all around the world.